And again, okay, let's start from the very beginning. Good morning. This is week 1, Tuesday, January 5th, 2021. This is Dr. Garais, and this is MED110 5DAX. Now, typically we would meet at 9 a.m., but due to technical difficulties, my wife works for Inova, and her server bullied my server. And of course, the Inova server won this morning, but it's good. Inova has technical people. They came out pretty quick and they solved it relatively quick, but not enough to have a 9 a.m. So this is our makeup, but it's okay. All the lectures are recorded. And also, just as a quick note, if you can't make a lecture, just make sure to do, to do your work so you can garner some attendance. And typically, attendance for the week gets posted around 12 noon on a Saturday. But we'll talk about due dates and whatnot. So those of you who did contact me, great, because you probably saw this thing right here, Professor Contact, very important. It goes, or you could look at the announcements and you have your ID here. And then of course I have announcements here as well. And I'll be posting the recorded Zoom lectures and whatnot, and also extra notes, and eventually your midterm and final will also be posted here in announcements. And again, communication, the key. If shoot me a text, shoot me a call, even if you have technical difficulties, because it's just how this hybrid computer world works now. You look here also, we'll be also doing discussions, and they require 7th edition APA format. And if you're not familiar with this, give me a call, or you can give a call to Ms. Laura De Leon, our librarian. There's also not only resources here, there's a nice link here as well. There's also a, you can go here to library, and then there's also links here and also videos here. Take advantage of this tab right here in your Moodle, library services and APA formats. And also, you know, when you're doing your research, even for small discussions, Google's nice and all, but it has ads. And the ad space, Google sells its ad space and sells, so it takes priority over advertisements versus information, which is not the way to go, especially in an academic forum. So let's look at the course syllabus, if it's cooperating with us today. Sometimes it does, sometimes it doesn't. Going once, going twice. If not, I'll just do it without the syllabus. But the syllabus is essentially all the rules that you need to know about a particular course. And I'm going to try to go over it as briefly as possible if it is letting me. Hello, 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 hello. All right, you know what? Let's put it aside. So what the syllabus would tell you is what are we learning today? Anatomy and physiology. So the goal of this particular course, which is a 2-part course, you have Anatomy Physiology 1 and Anatomy Physiology 2. It is a laboratory and lecture course. If you could look at your code here, up here it says LELA. LE stands for lecture, LA stands for lab, and 5 connotes Tuesdays, D connotes mornings, and AX is Alexandria campus is where the laboratories for this course will be. Look at the chat. Thank you, Ms. Brittany. So here's, of course, your textbook. Our textbook is OpenStax, which is an open and free format. If you're wondering why all the textbooks are electronic, it's because it shaves off almost 30% cost to the student. So nowadays, and also it's updatable. So you'll forever have the most updated books. And anatomy and physiology hasn't changed in a couple of 100 years. So, you know, let me see if it's still, if we could open up this course syllabus. Oh, there you go. See, I knew if we give it a second. Okay. So, of course, it's anatomy. If you recall your medical terminology, tomi means to cut, ana means pieces. So what are we doing with the anatomy? To cut into pieces. And physiology, logi, is the study of. Physio is physics, or how things work in the physical world. So you got to know the parts and how the parts work together. So it is of great advantage if you remember much of your medical terminology training, because it's really neat. So when you're looking at every chapter, you always have to ask yourself, right? What do I need to know? I need to know the parts and how they work together. And one of the big ideas that we have here in anatomy and physiology is homeostasis. Now, homeostasis, again, back to medical terminology, stasis means to stand still. Homeo or homo means the same. So your body likes to stand in the same place. It likes to be in the middle. It likes to be at 37 degrees Celsius. It likes a heart rate around 80 to 100 beats per minute, 12 to 20 breaths per minute. It doesn't like being outside of the normal. And if you look at the word normal, al pertaining to norm is the rule. The rule is we need to be in the middle somewhere, right? So that's the way physiology of the human being works. And when there's disease or when there's defect, that's when the patient has pathology. Patho, study disease. And that's when we get into trouble. So understanding homeostasis, understanding how your body likes to keep you in the middle is important. And we're going to be talking about that. We're also going to be talking about the basis for life. Like where does life actually come from? And we have to talk about the chemicals, a little bit of chemistry. We have to talk about the cells and where do we get our energy? Did you ever wonder, like sometimes when I'm driving, I always, for whatever reason, I always look at my hands and I think, I think these weird metaphysical thoughts like, hey, I'm alive. I can think, hey, look, I see colors. And all of this requires some energy, just like your car that I was talking about that you're driving in, right? It requires energy to go. So if you stop breathing and if you stop eating, no more energy, no more human being, and then the human being will cease to exist and will die. But we'd like to prevent that. And again, back to homeostasis, that's all we're doing for you future nurses and future medical professionals, or even current medical professionals, because many of you work in the field. This is essentially how your body works. And if you know how the normal works, then you'll know how abnormal or pathology works. And pathology, for you future nurses, has one of the highest failure rates on our campus. And it's because just like your medical terminology, you probably aced it, but I always ask in my on-the-ground classes, hey, what does anatomy mean? And everyone's like, well, they don't remember that tomi means to cut, ana means parts, logi means study of, physio is physics or how things work. So use that, your medical terminology powers. Digestive, urinary, cardiovascular, lymphatic, respiratory, and reproductive systems. We're going to be talking about each of those systems separately, but in the real world, all of them work together. So you're going to need to know the parts and how the parts work for each and every one of these systems. And the big one's cardiovascular. That's a biggie. Okay, delivery mode, of course, is hybrid. And hybrid means that we're going to, of course, do these Zoom sessions. And hold up. Oh, good. I'm recording. I hope. If not, I'll either redo the lecture or what happened to my syllabus? Okay. So, of course, the OpenStax textbook. Delivery mode is hybrid. So during weeks 8, 9, and 10, there'll be scheduled laboratories. Weeks 8 and 9 will be the laboratory, and week 10 will be your final exam. And those dates I'll put on the announcements, but it's essentially March 2nd, March 9th, and March 16th. And I'll put that on the announcements. So if you feel unsafe or you feel that you don't feel safe or you can't make it to those laboratories, I will have an alternative assignment but you got to inform me early that you're not coming to those laboratories because I need an RSVP, and it'll be in announcements for those dates. Because we need to identify and also minimize the number of people on campus at any given time. And I have to report in probably in the next couple of weeks how many students will be coming in on March 2nd, that's week 8, March 9, that's week 9, and for your final, March 16th. And grades will be posted by March 20th, okay? So that's hybrid. And all the laboratories will be held in Health Lab 1, 4th floor, Alexandria campus. And again, will be posted in announcements. Now, when you look at the things that we're going to be doing, it's 10% every week. There's 10 weeks and everything's 10%. So there'll be weekly discussions and there'll be weekly tasks. And the lesson is these case studies that we do. And we're going to go over the example of all three. And all three for this first week, task 1, discussion 1, and lesson 1 is due next week. By next week, which is, what date is today? The 5th? Before 9 a.m., January 12th, that's when everything's due, okay? Discussion, task, and lesson. And we're going to talk about that momentarily. Grading scale, those of you who are planning to apply to nursing, you must be at this B- level and above. But honestly, shoot for A all the time because we're medical professionals. You don't want to walk into a ward and knowing only 80% of the material. For all of the courses other than your future nursing candidates and nursing students, C or better. But please, you don't want to be in this range to be in the medical world. That's what, think about it. If you go to a hospital or you go to a ward, you want the person to know as much as they possibly can and to retain it as well. So this is a funky way of looking at things but everything, the task, lessons, and discussions, everything is worth 33%, or another way to look at it is every week is 10%. So today's lecture, you can go over yourself. We're going to go over microscopes, but then we'll also be going over this video regarding what do we see in microscopes, why are microscopes important, and things of that matter. If you have not done so yet, you can click on this, download your lab safety contract, and you could sign it, take a picture of it, and then you could put it in the task, and that should be good. But typically, tasks are these things called concept maps, and I'll be going over that momentarily. And lesson, you know, I'll show you exactly what. You don't have to do every single thing in lesson, but typically there's a case study in there, and that's the thing you have to do. Okay? And if there's a broken link or something, or something's not working for you, again, contact me immediately. And another cool thing you could do to contact me is there's an instant messenger that's also on your Moodle, which also I monitor as well as my phone, as well as emails. Okay, so it's every week, and week 5 we have a midterm, and week 10 we have a final. Now the midterm will be everything up till week 1, 2, 3, 4, right? Everything that we did, and then at week 5 there'll be a 50-item take-home multiple choice midterm, and there'll be instructions on how to do that. And I chose multiple choice because it is the format of how you are to be graded and judged for future things like NCLEX, TEAS, MCAT, you know, all the alphabet soup for registry exams that you'll ever take in your lifetime. So it's and week 4, we're also going to talk briefly on how to deal with the multiple choice examination and how to study for it. And of course, week 8, 9, 10, I'll be putting up video lectures, but we'll be doing laboratory where, and again, you paid for it. We'll be doing some dissections, we'll be doing a whole pig and I think kidney, a bunch of stuff. But week 8 and 9, March 2 and March 9 is reserved for the laboratory sessions, And week 10, March 16th, is the final written exam. All right. Oh, Mr. Francis, welcome, welcome. I thought we were going to meet tomorrow, but hey, we can also meet tomorrow, sir. No sweat. I'm just going over the syllabus. Again, take advantage of your library or the Learning Resource Center. If there's any inclement weather or policy, you can go to the website and sign up for this stuff called Rave Alerts. That's RAVE. And it sends, the university sends a blanket text to your defined phone. Now, the only times we're on campus is March 2, March 9, and March 16. So yes, kindly put your thing on mute. Thank you. Now, campus security, when you're on campus, if you feel in any danger or whatnot, and this also includes COVID stuff, okay? Again, if you do not feel around the time that we have our on-campus meetings, if you do not feel safe, especially regarding your health, and also we have a strict policy of you don't bring any personal items to the campus. You just bring yourself. Make sure to wear your mask at all times, lab coat, and we scrub in and we glove in for our laboratories. And again, all of that, when we get closer to March 2, I'll put an announcement on how we are to prepare. University-wide policies are all in the online Stratford catalog, which you can click on right here. Has to deal with all of these, but the ones that I'm going to focus on this morning is the attendance policy and late policy. So the attendance policy is this: if you miss this Zoom session and you don't do any work during the week or don't even log in, you'll be counted absent for the week. And like I said, I typically do attendance by 12 noon. So let's say, for example, you missed today's lecture. I hope you watch the video at least of the lecture, and then you go do something. You go do a task or a discussion. You try to do it before you try to do one of them before 12 noon on Saturday, because if I don't see any activity, I don't see any submissions, and also you were not present, and as you could see here, this whole thing is recorded. Even when I look at the chat, and when I also, you can easily see who's here and who's not here. And if you don't have scrubs, lab coat's good enough. And if you don't have scrubs or a lab coat, we can provide you with a lab coat. I have a set of lab coats on campus, for you guys, and they're cleaned regularly. Like, for example, like if we have a lab today, I clean them in the cleaners separately, and they're pressed and they're nice and they're good. And if we run out of those, I also have disposable smocks and things of that matter. So that's regarding your attendance. So try to show up. If you show up to this Zoom session, you're automatically get attendance. But I always promote, do your task, discussion, and lesson early, because typically my lectures last like an hour, hour and a half. The rest of your time should be performing these things. And also, during the time of your class, your class is rated for 9 a.m. to 1:30 p.m. I am available that whole entire time. So it's if you want a quick Zoom session, even after this, you could stay on board, or you can give me a call, Francis earlier, use you, sir, as an example. It's like, oh, I might not be able to make it. And I go, okay, let's do a one-on-one. So we made a schedule, right? Because if you can't, and I'm real flexible, because it's not like for this particular course, there's not like a million of you. Now for the other courses, I might not make that offer because I have like 30 in my other course, and but you can always call me or email me for a quick tutoring session. And I find these Zoom tutoring sessions or a session on the phone, they're really beneficial, and take advantage of it. We also have this new program called tutoring.com. Give me a call if you need some tutoring, and I could give you the links to it. And it's like this online service that we have that helps students out with, with their work. So that's the attendance policy. Now, late policy. You're lucky, I guess you're lucky I've been ordered to be lenient, because typically if we go back to on the ground next term, I go back to my former late policy, which also many of the nurses have the same late policy. There are no late policies. You either submit something on time or it's a 0. But since we're hybrid and since there's a lot of technical difficulties like what we experienced this morning, the late policy is this. For every day your assignment, which is a task, a lesson, or a discussion is late, it's minus 10%. So I always tell students for this class, please, even if it's late, don't even ask me if you could submit it. Just submit it, right? And many times I'm a sweetheart. I don't even take points off because I totally know that the majority of our students, there's a reason why you did stuff late. It's life. You know, the server wasn't working, your kids got sick. You know, if we look into all of our lives, it's a train wreck. So every day something's late, I have to chop off 10%. And I remind you about it as well. Like if you did a really good paper or a really good discussion, or you handed me everything, when I post the grade, I remind you, hey, you handed it in 2 days late, I got to chop off 20%. Okay, so, but your best bet, don't do stuff late. Do stuff early so that you can get some comments and feedback, and then I could get that back to you. Okay, so those are the two main things. And last but not least, honor code or academic integrity. If you want to cheat, be my guest. I catch you. I don't. I wouldn't care less, because this is what's going to happen. If you're a cheater, you're going to get caught in the real world. And I always tell this story of, I have a good friend of mine. We both went to medical school together, and we weren't the best students, right? On the scale of things, I'm not like an A student, and medical school was hell on wheels, and it's very hard. And there's also, if you think you guys have debt, ask anybody who went to medical school or got their DNP. That's debt in the hundreds of thousands. So, and also there's a lot of pressure to perform. I had a good friend of mine, Bimby. Let's call him Dr. Bimby. Bimby is his nickname, but it's not his real name. Bims used to cheat a lot. He was a really smart guy, but he used to cheat a lot. He even cheated on his boards. He made it all the way to second year residency surgery. You know, he's a friend of mine, but you know, I never liked that part of him. Well, guess what happened in second year surgery? Well, one of his patients went south and he didn't want to get in trouble, so he falsified medical records. Guess what? The falsification of medical records led to the patient's death. He lost his license, he lost his residency, and he also had a $1 million wrongful death suit, which he lost. So now he's broke, he's in massive amounts of debt, and he's living in his parents' basement. All because he's a cheater, and he's a killer. And his name is now mud to everybody in my medical school and everybody who ever worked with him. And even people who are like, hey, you're his friend? Ew. Because they know, it goes, that integrity is golden in our profession. And if you're into cheating, yeah, you're going to get caught eventually, and you're going to get caught in a marvelous way. I even remember when Bims, he cheated on, I think there are 4 steps to getting your medical license. He cheated on his step 2, and he was bragging about it. And I used to get irritated. I'm like, yeah, whatever. You know, I studied my butt off for my step exams. And he made it. He made it to surgery. Heck, getting into a surgical service is not easy, but he made it. And he made it through cheating. But guess what happened? All bad things. But if you're straight arrow, this is the place for you. So, and one of those things about plagiarism is this, right? Look at this website here, and also take advantage of your library resources so that when you do discussions, you don't get caught, using someone else's citation or someone else's material. So let's go over what's due next week. Task 1, of course, that's your, all you need to do is, here's a lab safety contract. You click on that. You sign it, you print it out, sign it, and then take a picture of it, and then you post it right in here. Okay? That's all you need to do. Easy peasy. Right? And if you don't have access to a scanner, just take a picture of it. It should be enough, because we need your acknowledgement that if you're going into a laboratory, there's a certain amount of danger. I mean, it's not really dangerous, but for legal reasons, and especially nowadays, that's why we have such stringent COVID protocols when we come to campus. Now let's go to discussions. Discussions are at least 200 words and must require at least one APA 7th edition citation. So discuss how to use an electron microscope allows for better visualization of pathogens. Now, when you look at this, you're probably going to ask me, how am I going to stretch this to 200 words? Well, let me pretend to be a student. Make this nice and big so you guys can see it. Maybe bigger. So discuss how to use an electron microscope, how an electron microscope allows for better visualization. So everything has an introduction, a body, and a conclusion. So your introduction, first you start off with your opinion. Right? What do you believe? Right? Do you even know what an electron microscope is? What's pathogens? Do we actually use electron microscopes to visualize pathogens? Are there any other different kinds of microscopes? So you have your opinion. You can have definitions here. You can also have the rationale or the reasoning why you believe your opinion matters. Okay? So that'll be the introduction. Now the body is where you have evidence. This is when this APA format comes into play. You try to find things are .org, .gov, or .edu, preferably a medical school or nursing. And preferably from the last couple of years. Typically they ask for 5 years, but we're in medical from the last couple of years. So getting something from a .com or from like middle school or something like that, or Wikipedia, Medscape, all those really common things that people use, it is not acceptable for academics. .org, .gov, and .edu, which is from a medical school or nursing school, those are vetted websites, and they're pretty much updated regularly. And you try to find something that's relevant. And we're talking about an electron microscope, we're talking about technology, so you got to try to find something from this year. Now, whatever your opinion or your rationale is in the beginning, it could be different after you look for some evidence. So your conclusion could be, well, I believe this in the beginning, but now I believe something else. Or your evidence could support on what you're talking about. So for right now, focus only on being able to write a good introduction, body, and conclusion in around 200 to 250 words with some evidence, and your citation should be in APA format. So let's show you how to do that. Let me minimize this. So I'm going to look up something about electron microscopes. So open it up. I'm going to Google an electron microscope. Can I use it for clinical? Now you see this? Add. Don't even touch that. Oh, look at here. What is electron microscopy? So University of Massachusetts Medical School. I can use this. This is good, right? And when I open it up, do not copy and paste all of this. Read it and write notes, and then do what? Paraphrase it. Use your words. Many times students take words and only move a couple of words around. That's plagiarism, right? What I do is I read through this, and I have a scrap piece of paper, and I write what's important to me, and then I write it in my own words. Okay. And it's so easy to check to see where you got stuff. between Google, Turnitin, and these other apps, it's so easy to find your percentage. All right. And if you are to quote something directly, it better not be more than 10%. So in 200, 250 words, it shouldn't be more than 20 words. I have people write, well, according to the University of Massachusetts Medical School, they do this. They take this whole thing. And that's plagiarism. You can't do that, right? Take it, use your own words, right? And if you're not good at writing, give me a call, because if you're not good at something, college is the best place to fix it. Actually, you should be fixing the things that you're not good at. So if you're not good at writing, get good at writing, because it is actually one of the chief complaints of our advisory board. We have these things called advisory boards 2 to 3 times a year. Professionals who hire our students, we wine and dine them, and then we ask them bluntly, how are our students? Are they good? Are they bad? We want to know the bad. That's what we really want to know. And one of the number one things they say that our graduates can't write. They can't write professionally. So, and they plagiarize, and they do all these really crazy things. So please don't do that, right? Because if there's more than one incident, I have to call you out on it, and that has the potential for you failing this course. All right. So, and it'll go the same, especially when your English courses and your humanities courses, they're very, very strict on that. So use your own words as much as you can. But you're using University of Massachusetts Medical School with the things that they said here to back you up. Now, see, you got advantages and disadvantages. They're all here. Now, it's time for me to do a 7th edition APA format, right? And I could look it up and all that, but I'm going to show you a quick way to get one out. So I have here, right? This is the website, okay? I copy it, and then I also look real quick. Official page of the medical school, and let's see. See, this is okay, but there's no date of when they updated this, right? So it's nice to use, but I could use something else. But I'm going to show you how to physically do the citation. So you go to things like bibme.org, and there's a whole bunch of other that can create a citation for you. So you click on, I only want to create a citation. I want APA format. I got it from a website. And then I put it right here. I put the website that I just copied right in here. I search, that's it. Then final step, right? And it was, hey, 2018, not too bad. It's 2021, 2-3 years, it's all right, right? But, you know, wish there was an author, and if there's no date, you could say you accessed it today. So I create the citation, and it's right here. Click copy and paste, right? I have my draft here in Microsoft Word. And after I do my conclusion and whatnot, I just write the word citation here, paste, and I'm done. And then I take this whole entire thing that I wrote, I make sure, run it through spell checker, everything, and then I copy it, and then I paste it onto, let's go back to your discussion. See here, add a new discussion topic. You click on add a new discussion topic, you write discussion 1, right? It'll automatically put your name as it, and then you paste everything you have to do in here. Boom. And it'll have it all here. And I just like cleaning up the format. Another thing you could do is take that Microsoft Word document, save it, and then click and drag it and put it in here. Or if you have it in a specific folder, you can access it via this. Okay? And then, of course, the all too important, make sure to post. Okay? All right, let's take a little pause. Anyone have any questions regarding on how to do your discussion? Because I might be going a little bit fast. All right, you could slow me down. Anyone have any questions? If not, going once, going twice, 3 times a lady. Let's now go on to, now we know what's due, task, discussion, and my advice is start today, right? You guys are go-getters because you guys not only communicated to me that there was no class this morning, you also did what? You also came to this, so kudos to you. Let's go to the lesson. And we're going to talk about this video and I have notes that I'll make available to this video as well. So in our laboratory on week 8, we're going to be playing around with a microscope. So don't worry about, don't go over any of this stuff. We're going to be going over this video, right? What's in, and don't worry about the microscopy lab, but if you click on it, there's some really neat notes. Here you go. Regarding the things that we're going to be talking about in laboratory, right? And the most important part, here you go. Parts of the microscope. Okay, remember anatomy, right? Anna, parts. Well, you need to know the parts. And in laboratory, we'll be going over the parts, but right off the bat, do you think this will be on your midterm? Sure. Right? And what do? The part and its function, anatomy, physiology, right? Easy peasy. Okay? And how to handle it. So go over that. It's really nice. And it'll prepare you for laboratory. But what is actually due for the lesson? If you see here, it's application assignment. And you're always looking for some sort of case study. And we'll be watching this video as well. Click on this. Right? Now, what I like to do is, see this thing here? This is a worksheet. You click on this worksheet, and what I do is I would copy it and then paste it on a Microsoft Word document. It's just easier to use, okay? Because there's some things you can fill out. And these items here that you can fill out is based on, let me get rid of this, is based on, drum roll please. Oh, Snapple, did I? Is based on this. Okay, so today, hopefully today, after, and this is so apropos to what's going on, right? You look over this case study and then you click on next, right? Now, and it tells about the problem, and then, and you see this, there's pictures and there's items here, and then you go through them, and this, right? Let me download, let's go back to this. Let's go back to this worksheet, and let me copy this whole thing, because this is what is due next week. I'm gonna copy it. I'm going to put it in a Microsoft Word document. Okay. And then these bits and parts, I just delete them. No, mess with, change the format and whatnot. Okay. So when you look at this, when you read that fatal flu stuff, you can actually just Google these answers. They're easy. But this DFA, this part 3, which is direct fluorescent antibody results, right? You will need stuff, right? Assay means a test, okay? And you're looking at these 4 viruses. So if I'm looking at this and I look at the viruses, you always have a control group, which is right here. So this is what positive looks like. It lights up, okay? Because this is what they call a fluorescent antibody stain or a fluorescent antibody assay or test. So a healthy person shouldn't have anything that lights up. So let's look at this. And there's a similar chart, but it's like words that you can put in. So if you're looking at the chart that we were looking at a minute ago, just this one. If you're looking at this chart, get rid of all the garbage. right? I didn't, there's patient 1, 2, 3, 4, right? You see there's boxes that we should outline, but it will look like this. So patient 1, when you look at it, is anything lighting up? No, it looks like a healthy person, right? So in the chart, you'll put patient 1, negative for RSV, negative for rhinovirus, negative for influenza, negative for HIV or human adeno, which, by the way, you know, influenza type A killed 240,000 people in 2020. So that should really bother you, why we're focusing on corona when there's a whole bunch of other things that can easily kill you a lot quicker. And we have an actual vaccine that's proven actual. But again, that's why you should do your own research. Don't listen to me. I sound like a sick conspiracy theorist already with all my crazy talk at times. Look it up yourself. I challenge anybody. Can anyone tell me what's in these tests? I can look up each one of these and it will tell you specifically what is the test for RSV, rhinovirus, and RSV is deadly. Which, by the way, here's another thing about testing. If I tested 10 people in a room, maybe 30 or 40% would be RSV positive, right? But then why doesn't it kill us? And we're going to be talking about the immunocompromised patient, and we're going to be talking about the susceptible patient and the susceptible host. So we look at this patient here. We tested my patient for these 4 viruses. We don't see anything. So patient 1 is negative. They are healthy, just like this healthy person. Patient 2, what do we see? Look at here. RSV positive. Patient 3, influenza positive. Patient 4, nothing. So if you're doing your chart, patient 1 would be negative, 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 negative. Patient 2 would be positive for RSV, negative for rhino, influenza, and HIV, human adeno. Patient 3, negative, negative, positive for influenza. Patient 4, negative, 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 negative. So that's how you would do it. And then you answer the questions, right? And oh, by the way, look, electron microscope. You just Google, like, what is the advantage of using electron microscope? That that article that I just showed you, the 3rd paragraph already answers that question, right? And then what else? Yeah, and then you just answer the questions, and it's based on, you know, going through this whole case. So this is the part that confuses a lot of people. And you could give me a call if you still, you know, if you still have questions, because this is a funky way to do stuff, but it is the prescribed way for the university. And it's the same thing with this. If you do a cell culture, so you could see here, right? Healthy person, there should be nothing. But in patient 1, they're positive for what? Whatever this C is, right? Patient 2, they're positive for A and C. Patient 3, B and C. Patient 4, C, right? And that's how you interpret that. And then you read about the fatal flu, and that's that. And you can also Google your answers. You know, that's not cheating. And that's how you do the and it's right here. Okay. Now, since I talked about chain of infection, and right now, even in your own home, there's 250 things that could easily kill you. It's floating around in the air. But it begs the question, why are you not dead? Why are you not sick? Okay. My daughter early this morning had to be taken to the hospital. She doesn't live with me. She's an adult. She's a nurse, but she had severe abdominal cramping and whatnot. At first, everybody in the family was hyped because they thought, oh, she has COVID because she's a nurse. No, I think she has food poisoning, but we'll see. I'm supposed to call the hospital later today, right? And it's fun being admitted to the hospital you work in. Well, she was not saying partying, but you know, she was eating whatever she wants to eat for you know, over the New Year's. She wasn't really keeping herself healthy, staying up late because, you know, we were family, having a couple of drinks. And by the way, alcohol, I love alcohol, but it's a depressant. And do you ever notice how sometimes like if you drank a little bit too much, the next morning you have a sore throat? It's because of this. So let's look at this video of the chain of infection. Why is it so loud? Okay, and I'll stop it momentarily to talk about certain things.
Welcome to this session on breaking the chain of infection. In my previous session, we have spoken about what is the chain of infection, what are the elements forming the chain of infection. Today, we will be looking at how to break this chain of infection. In other words, how to achieve control over a disease, how to reduce the number of new cases of the disease. So what I mentioned just now was the word control. What do we understand by the word control, especially with reference to communicable diseases? When we talk of control, we need to remember few things. And what are those? We need to look at when we achieve control of a disease, we are trying to reduce occurrence of new cases of the disease in the given population. In other words, we are trying to reduce the incidence of the disease. Incidence is nothing but new cases occurring in the population in a defined period of time. So, we reduce incidence by achieving control of a disease. The next thing which happens is control will enable the disease process to halt in the individual who is affected. The duration of the disease will be reduced in the affected individual. Consequently, the risk of transmission of the infectious agent from the affected individual to the susceptible host is also reduced. So, shorter the duration of the disease, lesser is the risk of transmission from one person to other. So, that's another important element of control.
Okay. Now, does this sound familiar? Of course, because this is exactly what the CDC, Department of Health, and everybody in the free world is trying to do. Because, of course, the other thing that we always have to think about in the medical world is the financial burden of your patient, and also the financial burden of the community, because if more people get sick, it has a cost to it in jobs. And right now, this last year, you could see, I just read an article in Forbes magazine that there's going to be $200 billion worth of bankruptcy that's going to be tied up in this country. And if you look around, look at the malls, everything's closing. And because of what? COVID, because of a disease. Incidence, new cases, transmission is trans, the word is a prefix that means across, right? So do you notice she said the word control? She didn't say the word eliminate. You cannot eliminate disease. You only can control it, okay? Because and that's another problem I have with all of this COVID thing. It's going to kill who's going to go. It's going to kill who it's going to kill, okay? All right? You're going to get sick, and exposure is only part of the equation. There is also a psychological component, okay? That's why mental health is very, very important politically now. Well, it always is, but now more than ever. But do you notice that you get really sick if you're really down? You will learn in anatomy and physiology too that your emotions and prolonged stress, like, you know, if you lost your job due to COVID, or you got family members who are positive, or family members who are sick, or family members who are at risk, it takes a toll on your mind. And then what happens? Increases your cortisol. Your increase in cortisol will decrease your inflammatory response. Inflammation is part and parcel of your first line of defense for your immune system. And when that goes down, that's how you get sick. Okay. So like a classic example is my brother-in-law. He works, he's an ICU nurse, and he lives with my in-laws. My in-laws are very high risk. He transmitted COVID to the in-laws and couple of my nephews. Right now, he works every day. 7 days a week in the ICU. Does he have COVID yet? Nope, but he had pneumonia 6 months ago. He had all these other things going on, and now he's only, what, 28 and has hypertension. Because why? The psychological and physical stress of doing this job. And it goes, but since he follows his PPE, he tries to stay as healthy as much as possible, he is not a susceptible host, but he's good enough to transmit. And that's why we wear our PPE, because we can't eliminate the disease, but we can control the disease, and we can control the environment in which the disease, like COVID, thrives. Viruses thrive in a immunocompromised state. So, whoopsies. What's going on? What happened? Okay, that's my video. Did I pause it too long? Well, like I was saying, so it is the people who are immunocompromised, and it's the people who are susceptible, right, to disease that are in most danger. Okay. Now, let's look at the chart. She gets there once we get there. If we get there, let's do this. This is not cooperating with me. Let's look at a chain of infection picture. The video is kicking me out for some reason. Now, they call it a chain. Here's a nice picture. They call it a chain because, like a chain, you can break the links. Now, it all starts with an infectious agent. It could be a virus. It could be anything. Because viruses, they're not bad things. Bacteria are not bad things. They're just living things. And if you let it live, it'll live. Now, that's what the infectious agent is. It's the pathogenic, it's the thing that will potentially cause disease. Now, what I mentioned earlier is there's a whole bunch of infectious agents in your body right now. But the reason why you're not outright sick is because your immune system is controlling the infection. It can't eliminate it, but it's controlling it, right? So you could be a reservoir, right? Or someone who will transmit it to something else. So this reservoir, this person is usually asymptomatic, right? Like my brother-in-law. He's walking around the ICU. He's probably super COVID positive, right? But by the way, he got tested, what, half a dozen times already in the last year? He's never been positive, but everybody else in the house is, because he's the reservoir, right? Now, there needs to be a portal of exit. And that's also another reason why we're masking up. We're masking up is because that's a potential portal of exit, because early in the course of COVID, we found out that it has a predilection towards lung tissue. So if you got a whole bunch of infectious agent and you're the reservoir, you're asymptomatic, you could be breathing that on other people. Or you could be touching your face and then touch a door handle, touching your face, and then touching a keyboard, right? And then somebody else is using that keyboard or that phone, okay? So that's the portal of exit. How did that infectious agent leave the reservoir to go to somebody else? Now, the mode of transmission, there are several modes of transmission. It could be airborne, right? If I sneeze on you, that's droplet, right? Another horrible thing about people who spit on the ground, when you spit on the ground, that spit or that sputum dries up. When that dries up, it flakes up and then travels around in the air. Like I mentioned, 250 things that could easily kill you, flying around. Then, of course, if there's a portal of exit, there has to be a portal of entry in my susceptible host, okay? And it has to be a susceptible host, somebody who is immunocompromised. So if you look at the data on COVID, because do you see the majority, it's like something like 82% of COVID deaths are patients with ages greater than 65 years or older, and not only 65 years or older, they have multiple diagnoses, like they're hypertensive and they have heart disease, and they're just multisystemic, right? So if you're healthy, you wear your PPE and you keep your stress level to a minimum, the odds of you getting something are less. But remember, we can only control it. We can't eliminate it. Right now, I have current count of all my students. I have since last March, I have 8 students who stated that they were at one time COVID positive. All of them work in high risk areas, and all of them wear their PPE because that's their job. All of them, actually more than half of them have children. None of the children got it. Nobody in the house got it, just they did. And all of them all claimed that they were wearing their PPE religiously, but for whatever reason, they were a susceptible host. Actually, 2 or 3 of them, I was talking to them and they were like, oh yeah, they were giving me these crazy hours and they weren't giving me my back pay and they won't let me take my PTO. Doesn't that sound like stress? Doesn't that sound like life? And then of course, did she get sick? Yeah, she got sick. She had a baby and she had a 1-year-old in the house. 1-year-old negative. Everybody else, grandma negative. Everyone's negative, right? Because remember, you have to be a susceptible host. So everything that we do, our PPE, distancing and all that, is to break the chain of infection, right? Portal of exit and mode of transmission. If I'm 6 feet away from you, right, it's very hard for that virus. Viruses are very, very small. They are so small that they can go right through your skin. They could go right through your cell wall. They could go right through that mask. So being far away for something that small, like 6 feet, it's really hard, but it finds a way, right? So, you know, all these things that the Department of Health and Dr. Fauci and friends are all promoting, it's based on science and it's based on data that we know how to break the infection, right? But if you're a susceptible host, you're gonna get hit, right? It is what it is. And if you also look at the data, I don't understand why colleges are shutting down. I don't understand why schools are shutting down. There were currently no deaths associated with any colleges, any major colleges in the area, but hundreds of people became positive. Of course, they're going to become positive. When you come back to school, aren't you stressed out? Especially in the way everything's getting all hyped up and ramped up, right? I have a colleague from University of North Carolina, and I asked her how many deaths. And she was like, none. And he goes, how many were positive? Like 3,000 students? And she goes, yeah, we had to shut down campus. And I'm like, all right. She's one of the deans there. And I was like, and I go, you know the data, but again, fear. So know that chain of infection. Know the examples on for each of the parts of the chain. And we already talked about how we can break those parts. All right, anyone have any questions regarding breaking the chain of infection, or how I could ask that as a question? Anybody? Anybody? If not, let's go to this video, because this video is really cool, because histology, logi, study of tissues, and microscopy, or microbiology, study of micro, very, very small life. Now, why is the reason that we're starting with cells and microscopes? Well, it's because of this. Let's look at this. This is a nice picture. So if you look at this picture, we're going to be talking about the chemicals probably next week. Atoms, right? The smallest nuclear element, and then they make a molecule, and we're going to be talking about in week 3 DNA. And then atoms make molecules, molecules then make cells, cells then make tissues, tissues make organs, organs then get organized into systems, and all the systems together work to keep this little beautiful little curly haired girl alive. Now, if you understand how all of this works, let's say we have something, a problem in the genetics. Don't you think that's going to affect, right? Let's say she has something wrong with her on the chemical or the atomic level. Don't you think that's going to affect her genetics, her DNA, which is the blueprint of who you are? Then it's going to mess with cells. Then you get a tissue problem. Then you're going to have an organ problem. Then you have a system problem. One system gets messed up, and then a whole bunch of other systems get messed up. And then you get multi-systemic failure, and then this little girl gets to die. Okay? So knowing and understanding this pathway, I used to erroneously think that the word pathology meant the pathway of disease. But patho means disease. It's the exact opposite of homeostasis. Everything in your body wants to keep all of this in working, functioning order. But if something gets in the way anywhere down this road here, that's when our patient gets sick. And you can see that's a challenge for us, because when do we see the patient? We don't see the patient before they get sick. We see the patient when they're already sick, when they're already at this level, a problem level, right? That's why internal medicine nowadays, modern internal medicine, is more about prevention. Because once you get diabetes, there's not much I could do. But if I can prevent that in you, which, by the way, again, we're all hyped up on COVID. No one wants to look at the incident of juvenile diabetes. No one wants to look at how many African Americans have kidney failure. It's in the hundreds of thousands. You could look it up. Look up National Kidney Foundation, which I am a member of. No one wants to look at that. No one cares about that, right? But we're all talking about. We're all the media is obviously going through a narrative. 2 years ago, I was helping organizing the juvenile diabetes. We had a local 5K. Only 200 people showed up, right? But if you talk to everybody who showed up, they had a child who was on dialysis. They had a child who can't walk. They had a child who had an amputation, and that's only in this area. So you can only imagine the scale at which this disease is not only debilitating, hurting, and killing our children, right? Go look up the cases on how many COVID cases, how many COVID positive babies died. You can count them on your fingers. And I'm actually wondering about those diagnoses because, and I don't want to say I love telling this story. A good friend of mine, he had kidney failure, and his dialysis got pushed back. Instead of like every other day, it was like every 3 days, every 4 days. And then he went into kidney failure last May and then died. You know what? They swabbed him while he was in ICU, and then they wrote cause of death, COVID. No, yeah, cause of death, COVID, because everyone's so focused on COVID, they weren't looking at my friend who was in the kidney center who needed his dialysis. I chewed out the nephrologist for it. I'm like, y'all, like, his wife and his kids they're thinking of filing suit because but the hospital's claiming that they didn't have the proper resources. Yeah, because they were believing the hype instead of doing your job.
Welcome to Anatomy and Physiology at Glen Oaks Community College. I'm
So,
Dr. Renhard.
I'm trying not to push this lecture because we're already at the 1 hour mark, and you guys are troopers for coming in extra. And so I'll post a video and notes so you can watch this. But the main takeaway I want you to get out of this is, and I'm gonna also is that, and we're gonna go over this. I'm gonna go over a couple of slides just to give you an example. Look at the slides, and I have pictures. And again, this is an example of how microscopy, which is microanatomy, can dictate the physiology or how does the parts work. So right now, what you're looking at here is a fat cell. These are called lipocytes or lipid cells, also known as fat cells, also known as adipocyte. And you can see again how your medical terminology powers can help you remember stuff. Do you see it's like you have like these big holes right here? So they're bubbly, and this is a fat cell. And the function of the fat cell is to store glucose. So you could see how it's just one big open box, and that's its function, is to store things. So it's got to be in the shape of some sort of box. So you should be able to identify, like if I showed, and I'll also have notes with classic pictures of the things that we're talking about on, and also a screenshot of this video. But watch over this video after I post my notes, and you will see that all the pictures, if you look at it and use your imagination a little bit, you can now realize like, hey, number one, this is a fat cell. Number two, they're what? It's nice and wide and nice and open so that it can store glucose. So fat isn't a horrible thing. It stores glucose. But what happens if you have too much? Because remember, our body likes being in the middle. It doesn't like too much. It likes just right. So too little fat, not a good thing. That's malnutrition. You won't be able to have reserve fuel, which is glucose. Too much fat, you'll have too much fuel, right? Which is most of us here in the United States. The latest report, if you run by the current standards of obesity, it was something like 87% of Americans would at least be class 1. And also, just like that wonderful Lipitor commercial, there's this guy, he's looking good on the beach, but then when you look at his numbers, it's not very good. You could be thin and have hyperlipidemia. My uncle is that he's a twig. And also doesn't eat that much, but he's diabetic and has a hyperlipidemia. You assay or you test his blood, it's all, here's another one. And you could see this big open space and the nuclei are on the side or on the periphery. And this is again, another fat cell. Here is a blood smear, and you could see the majority of the blood, they look like little Cheerios, don't they? Here's a Cheerio, there's a Cheerio. Those are red blood cells. And they're anucleated. That means they have no nucleus. And what's in the middle is hemoglobin. Now, hemoglobin, hemo meaning blood, globin meaning protein. That's the thing that your oxygen and your carbon dioxide get to ride on. And then the majority of your blood is made out of red blood cells. You see red blood cells all over the place. Now, what are these purple things? These purple things are white blood cells. Okay. Now, why is this colored pink and purple? It's because of the different stains, and you'll see that you'll see that in the video and other notes, right? So I could take a picture of this and I could point to, what's this Cheerio? And you'll tell me it's a red blood cell. Hey, what's this purple thing? Oh, that's a white blood cell. And what's the purpose of a white blood cell? Is to defend. So this person, they only have a couple of white blood cells. That means this person doesn't have an infection. If this person had an infection, we'd see purple all over the place. Now, platelet, you might not be able to see. Like, it's like that. See that? Like, it looks like dirt. It looks like little specks. See that? That's a speck. That's a speck. Platelets are not like whole cells. They're like little sticky parts that make sure that if you bleed, it makes the blood all gummy, and so and it creates a connection with fibrin. So fibrin is this protein, and then it clots your blood so that you don't bleed to death. But a question that I ask, if I showed this cell, and I could take a picture of this and then put this as A, and this Cheerio over here is B, and then I could ask you, which one's a red blood cell? This one's a red blood cell. Which one's a white blood cell? This one, or this one? Let's look at another one. This looks like bone tissue because of this hyaluronic. Now, when you see the bone, it's in layers, right? Now, bone gets its strength. Bone is an actual living, breathing thing. It gets its strength because of its layers. And here's a classic, here's another classic how, you ever roll up a newspaper? If I hit you with like one sheet of newspaper, you'd be like, hey, what the hell are you doing? But if I took the whole newspaper and I rolled it up really tight, then I hit you with it, wouldn't it hurt? I believe it would. I've been in martial arts more than half my life. And when I was a kid, one of my teachers did a demonstration where he broke a brick with a newspaper, with a rolled up newspaper. And you could see how this is how your bone is essentially just layers and layers and layers of rolled up bone cells. Here's some muscle, right? And you could see how if you use your imagination in it, There's a whole bunch of ropes cut diagonally, and that's all your muscle is, a whole bunch of muscle fibers. Here's bone again. Look at it. It's in layers like a tree. It's easy to break a twig, right? But break a larger branch that has a lot. And you could see here, this is the nuclei, and you could see here there's an opening. Bone is actual living and breathing tissue. There's a nerve, artery, and vein in here somewhere. Here, now, you saw how bone, how organized it was, right? Now, this is cartilage. You see how there's like more spaces? So that's what gives cartilage its greater flexibility. Bone isn't flexible. You saw it's layers and layers and layers upon tight layers, but this is what? Well, loose, right? And you can see a little bit of some stuff here. And that's, we need that looseness, right? So let's find another classic one. Here is your columnar epithelia of your, most likely your respiratory tract. And you can see it's like it's columns. Now, this reminds me of toothpaste. And when you think about toothpaste, if I squeeze toothpaste, stuff has to come out. So let's see if we can find one. See how this, you got to use your imagination a little bit. How it looks like a wine glass or a champagne flute. That's a goblet cell. Goblet is like, you know, where you put wine or whatever. Me, again, talking about alcohol, lovely, right? Well, that makes the mucus, and then the mucus has this little thin lining here, which not only lubricates the respiratory tract and your GI tract, it also traps viruses and all these other stuff, because that's also a non-specific first line of defense in your immune system, okay? So I'll have another video, I'll have notes on this entire video. So I'm gonna post them today, and look through the video and pause it periodically and look at the pictures and the notes that I'm going to put regarding this, because I could easily show you a picture, and then you tell me what it is. That's identification. And the second thing is what does it do? So it's at this point, does everyone know what they need to do for next week and what's due next week? Okay, let me turn off the recording.